watching out for you. This is Newswatch 12 at 6 with Brian Morton, Ashley Hall, Chief Meteorologist Matt Hoffman, and sports with Cameron Derby.
The American Cancer Society says prostate cancer is the second most common cancer in American men.
Newswatch 12's Kate Houston breaks down what happens during an annual screening and when doctors say you should start getting them.
I had no symptoms of prostate cancer that I was aware of.
The most common sign of prostate cancer is none at all. That's why 57-year-old Eric Werner was surprised to find out that he tested positive after his first screening in almost 10 years.
I've never had anybody said that, if you do nothing, you won't live 5 years.
Doctors say that men with a normal risk should start getting screened at age 50. Higher risk patients, such as men with history of cancer or African American men, should start around age 40 to 45. The screening consists of a blood test looking at the levels of prostate-specific antigens, or PSAs. These levels and what they mean change with age, which is why doctors say annual screening is essential. Doctors will also perform a digital rectal exam to feel the texture of the prostate.
The normal texture of the prostate should feel like the tip of your nose, but if you feel anything that's nodular or irregular or firm, the bone right here, that's considered an abnormal exam.
If the test is abnormal, patients will usually get a transrectal ultrasound-guided biopsy to take samples.
While all of this sounds fairly straightforward, screening for prostate cancer has been met with some controversy. The side effects of removing the prostate are life-changing. There can be issues with urine control and sexual function, among others.
Because of this, the U.S. Preventative Services Task Force previously recommended against annual PSA screening.
Unfortunately, what you then started to see was that a lot of patients would come in with very advanced disease that we were not able to treat.
It has since rescinded this, saying the decision should be an individual one. Eric tells me his only regret is not insisting on being screened often enough to detect his cancer earlier.
I had no symptoms, and prostate cancer, if you catch it soon enough, you have many, many different options.
Reporting in Medford, Kate Houston, Newswatch 12.
Newswatch 12 is going blue to raise awareness about prostate cancer. We're digging into the diagnosis and treatment process to help keep you and your family safe. We'll bring you stories of patients and their families dealing with this disease. Be sure to stay with Newswatch 12 for Prostate Cancer Awareness Month all September.